Hi, everybody. This is Dr. Kamadi Reddy. I'm the Chief Medical Officer here at Nudge AI. I'm making this video to share some very exciting news about what we've done here at Nudge that is just groundbreaking. It really is the future of healthcare and AI. If I'm excited about this, it's because I feel like a clinician who's finally gotten the tools they need to do their work efficiently. Our entire team believes that what we've created is going to really move the needle in terms of clinical workflow, reducing patient burnout, and just so let me just get to what we're doing here. The thing is, since the advent of frontier models, LLMs, generative AI, everyone thought, hey, we'll just replace the dictaphone with an AI scribe, and that's okay. But that's not really what doctors ever wanted. We've always wanted is resident physicians working underneath us. Do you want that smart, educated assistant, a co-pilot, if you will, to where you can generally orchestrate the patient encounter and what you want from clinical document you want to create, or how to run your clinic, and have your people underneath you, or the training physicians, the residents we call them, or like the psychologists in training, if you're in the behavioral health space, to fill in the details for you. And if they were a good resident, they would just do it. So you became the orchestrator, not the person who did all the detailed work. And that is exactly what we've done at Nudge. We've evolved from something that just takes notes and transcribes what you're saying. The age of that scribe AI is over. We need to move to creating a true clinical co-pilot, a junior resident that physicians and other providers can trust to create notes efficiently, quickly, and that comply with high quality standards that are needed to make sure that everyone is reimbursed and happy. So I want to show you these two features that have catapulted Nudge into this new era. This is the Nudge interface. Now, Nudge relies on templates. I'll show you one right now. What we've added here is this. Think of it like a ChatGPT interface built into the template where clinicians and providers in general can use natural language to code into the system and tell us what they want to be done in an automated way in the note. So they can code in complex instructions and have the note be able to create those instructions for us. See, without this, you get like a simple note. I'll dictate one for you and I'll show you the end note. If you want to use Nudge as a regular old dictation service, you can do that and make it so we scribe you word for word. Okay, dictate a note on our fictional patient, John Cena. Now let me show you the note that was created. And if you look at this note, internal medicine outpatient follow-up, it says everything we talked about with Mr. Cena, right? His subjective, what he came into the visit for, what we saw in the physical exam, including his vital signs, everything I dictated, his labs reviewed, which I also dictated, word for word, number for number, and the assessment plan, his problems, right? High blood pressure, edema, obesity, and tobacco use disorder. Kind of some bullet points on that, follow up and return in 3 months. Your standard kind of everyday note. This is what we all come to expect. And it took almost 3 minutes to dictate this note, and I had to do it pretty much word for word. Again, the scribe function is there. But we want to move past this scribe function, because if I gave this patient, I saw them with a junior doctor or a really smart medical assistant or nurse practitioner, I wouldn't have to take 3 minutes to dictate this. Instead, I'd give them the general schema of what I found, let them fill in the details, and do things creatively. I want to give this person more advice on how to quit smoking and use the current guidelines. How do I put that in there without having to go memorize it or read it off a script somewhere? How do I put in, for example, a risk calculator when people have heart disease or risk factors, to give them a percentage of what their risk is in 10 years of getting a heart attack? Those calculators exist in the world, but how do I get that in? These are all extra steps that I'd have to go do. If I had a smart assistant, I'd just go calculate the risk thing, put that in the note, put some more information about stopping smoking and as such, get guidelines and put them in the note as well about a lifestyle change, give them specific targets, and also make it maybe, let's say, like an after visit summary. They can get something they can read in plain English. So these things all previously were difficult to do, and that's what we have evolved our system to do very easily with this ChatGPT interface built in the template. So let me show you how we would do this now. If we open up a template, let's say my internal medicine SOAP note template, you can see we've added this box, and this template instructions box is the clinician, the provider's way to, in plain language, write down what they want the note to do. Now look at what I've created. Conditional statements. If the patient is a smoker, add a short evidence-based smoking cessation summary and paragraph into the note automatically. So the nudge can figure out whether it needs to add it or not. I don't have to remember. If the patient has a cardiometabolic disease and we have the numbers that would go into the calculator, calculate the risk score automatically. If medications are prescribed, do something really creative. For example, look up the approximate monthly cost of the meds so patients will know and I can give it to them. Estimate and use generic prices available. I can just say this to Nudge, and because Nudge has access to the infinite publicly available database of medical information and clinical reasoning, it could pull this information and weave it into the narrative and include a short patient-friendly visit summary at the end of the note and specific follow-up instructions. And I put some dot phrases too, which are macros that doctors commonly use. We can park those in this custom instructions as well. So you can see here that this can be really powerful, this box. It can be powerful because it can accommodate a very large array of instructions. This is a very powerful way to use custom written instructions to program the note creation. Every time someone uses this template, Nudge will listen to the transcription and go, I'm going to apply these rules to it, see if the conditions are true. If they are, I will add this additional information in a very elegant way into the note. And that's one half of the powerful set of improvements we've made around this ability to direct the note. The other is, let's go back to John Cena. But this time, what we've noticed is instead of transcribing individual lines of text, I can just give Nudge a general overview of the kind of note I want to create, all verbally in a very quick dictation. And it first interprets what I mean, goes and looks up the data, incorporates it into the final end note. So the note becomes infinitely better. Let me show you. With Nudge, it's only a couple clicks to start. This is Dr. Kamani dictating an outpatient internal medicine progress note on patient John Cena, 54-year-old Caucasian male, here for routine follow-up in clinic. Known history of hypertension, hyperlipidemia, obesity, and active tobacco use. He's currently taking lisinopril 20 milligrams daily, reports intermittent missed doses, smokes about 1 pack per day, minimal exercise, diet with heavy processed food. Past medical history, hypertension, hyperlipidemia, obesity, allergies, none, medications, lisinopril 20 milligrams daily, physical exam, vital signs, our blood pressure 152/94, heart rate 84, respirations 16, oxygen saturation 98, he's afebrile, weight 248 pounds, height 5 feet 10 inches, BMI 35. Make a 8-point normal physical exam that's thorough. In terms of diagnostics, the lipid panel with total cholesterol 242, LDL 168, HDL 38, triglycerides 210, hemoglobin A1C was 5.2, BMP was normal, including creatinine. In the assessment plan section, insert my dot phrase on hypertension, update it using current guidelines, based blood pressure targets, clearly state that today's reading is above normal and that he's not controlled on current medication, and that we're going to increase his lisinopril to 40 milligrams daily, and make a line or two on how important lifestyle change in terms of sleep, exercise, nutrition is in improving his blood pressure control. Next section is hyperlipidemia based on age, lipid values, blood pressure, smoking status, absence of known atherosclerotic cardiovascular disease, apply current primary prevention guidance, and document the rationale for starting a new drug today, Lipitor, 20 milligrams nightly, include expected LDL reduction, and when the lab should be rechecked. Next section for obesity, summarize evidence-based lifestyle interventions shown to improve blood pressure control. Keep this concise and practical. And for smoking, include counseling on smoking cessation. Now let's end the session and submit audio. I want you to be aware that what we did there was different. I didn't have to dictate every single word. I just told it what I wanted. I told it what to look up and insert in the note. I told a general schema of, hey, this guy's here for these problems. Some are controlled, some are not. Some are good, some are not. And document that we're going to increase his medications. We're going to start a new one, and we need to go look up something about smoking, about lifestyle change, et cetera, et cetera. We need to calculate some risk scores because we already have the written instruction. So Nudge uses the written instruction in the template plus the verbal directives I give it to create this note. And that's exactly how a junior resident or training physician would create notes for us, right? They would take my verbal instructions and the guidelines I wrote to them, or I could send them a text message like, hey, whenever you have a patient like this, always do this and this. That's all I'd want to tell a co-pilot or a junior resident, right? I wouldn't want to tell them more detail. I want them to handle it. Now the note, I cut off a minute in the time it took to do it. Now let's look at the end on the note as it generated and see what we got. This is much better. Assessment planned, hypertension uncontrolled. The bullet points around what we did talked about lifestyle modifications, sodium reduction, weight management, physical activity. Want to plan to continue, medication adjustment, increasing less to 40, edemia. Talked about the lipid panel. What's cool about this is not just that it documented that we're starting the person on Lipitor, but it actually calculated, using the guidelines, how much it was going to reduce the LDL by, which is incredible. So that is the justification thing we told her, right? That's stuff I have to go look up, put in the calculator, go look at primary research. Nudge does all that for me. And it was all in the same dictation, all verbal. Remember we had the written instruction about looking up medication costs? It did that too. $5 to $15 a month for Lipitor, and did it for lisinopril as well. Now, obesity. Remember we told it to look up evidence-based lifestyle interventions? Talked about caloric restriction, Mediterranean dash diet, 150 minutes a week of exercise. I did not have to dictate any of that. I could dynamically on the fly just tell it, look it up, put it in the note. And tobacco use disorder, that's all I said about smoking. And here it talked about what we talked about with the patient, including here's what pharmacology works, here's non-pharmacology that also works. It even gave the number for a 1-800-QUIT-NOW, which is group counseling to quit smoking. This is a good note. And by the way, remember we had the instruction, verbal and directives, to assess the 10-year cardiovascular risk. This is something I have to go put in a calculator. It'd be so annoying to do. It did it, though. This guy's risk is approximately 15 to 20% based on the fact that he's a smoker, total cholesterol, systolic BP. And so I think John Cena in real life is actually pretty healthy, but it doesn't have this risk. But you can see how important this information could be. It also included this after visit summary. This is something that I would have to go instruct the nurses to do, or an NP, or a social worker, or an assistant. Nudge just did it. It followed every one of my written instructions that I had in the template, the things that I want Nudge to assess. But more importantly, instead of me dictating every word, I can just direct it. This is the future of AI in helping providers care for patients. It's not providing them just a dictaphone. It's about giving them a virtual doctor in training that is educated enough to go fill in the details for them and can use the power of LLMs and the world of publicly available medical knowledge to make an incredible note. This is what I expect of a really good physician's note. Risk calculations, what the effectiveness of the meds are going to be, how much they cost, a patient-friendly version that's appended at the end of the note. Stuff that I would take a long time to do manually, but I don't have to do it manually. I can use Nudge. The beginning of a great push for us into really moving us forward into what doctors and providers really want from AI, not just a scribe. Thank you.